Well, joining me now is Dr. John Hovanesian, and one of the things that surprised me was the Harvard Eye Institute, Harvard Eye Associates. You know, my first thought when I saw that was something to do with the Harvard College.
Harvard Medical School or Harvard College,
School,
that's
yeah.
right. Well, originally it did, and you know, like many things, a name starts for a you know, an entity, and then the name continues on well after the original naming took place. And the first three folks who started my practice were trained at Massachusetts Eye and Ear Infirmary, which is Harvard Medical School's ophthalmology program. And since then, we've taken on 8 more doctors, and so we have, most of us did not actually train in Massachusetts, but the name has stuck because for those first 3, when they had to come up with a name for their practice, Harvard Eye Associates seemed to be the most appropriate one.
Okay. You know, my second thought was whenever I hear about this new eye medical treatment for eyes, I remember about 15, 20 years ago when they came out with this new laser surgery, and it was the new thing, and everybody was running to go do it. And then it didn't work out, or people didn't like it, and it was like, and I got it, I was, it kind of, I can't see close, I can't see far in one eye, and it just wasn't what I expected. But I guess that's the thing, is from reading some of the stuff you've done, it's come a long way.
Oh, the last 15 years have been unbelievable in what's developed in eye care. And like any new technology, when it first comes out, it offers some new things, but there are challenges and limitations, and we have to work those out. In the early days of LASIK surgery, it wasn't even LASIK. We were making incisions in the eye. All we had to guide us was basically a good sharp knife and a good steady hand. And today, it's not at all about the surgeon's hand, although it takes experience to do the current procedures. It's all guided by computers and laser imaging and things that are far more precise than we had 15 years ago. Nowadays, we approach eye care with so much more technology than we did then. And I'll tell you, I'd be happy to see you as a patient, because we may be able to help you too, because so many of our patients truly who had procedures 15 years ago who are for some reason not fully functioning like they want to be, we can help because the new technology is so good.
I mean, that's the thing. It's come a long way.
Certainly.
I think, a lot of people wearing contact lenses. I wore them for a long time. I wore them for probably since high school.
Yeah.
And it just got this dry eye were so bad where I couldn't wear it longer than an hour. My eyes would be in such pain that it just stopped working. I can't wear contacts anymore. It's
a perfect segue to our topic today, which is dry eye, because so many people come to us for corrective surgeries because of their intolerance of contact lenses. And so many people have dry eye problems, eye comfort problems that go, even who don't wear contact lenses. So I completely understand. And yet, with the newest technologies for surgeries that we do for vision correction, it's a different subject from dry eye, the discomfort people have is very, very minimal. Assuming, the person going through it is a good candidate, assuming the person has healthy eyes and stable eyes that are not changing over time.
Well, so someone, just in my normal day, if I carry Visine around or something like that, is it something that I just need to just keep putting in my eye so that I don't have the dry eye problem?
Well, there's no question that if you have dry eye, you have a sort of a body chemistry issue that causes your eyes not to be well lubricated, and it's caused by an awful lot of things. We see it as a result of age, for sure, and here in the village, we're all right in that category, and of course a number of other things, including medications. One of the most often overlooked things are medication, blood pressure medications, medications that are mood-altering drugs, and antihistamines are probably the 3 most common offenders. And then, of course, environmental factors. Where we all live in Southern California, it's a desert here, and we may have the ocean nearby, but particularly in these colder weather months where we're using heat in our homes and we're blowing the defroster when we get in our cars, we have very offensive conditions for our eyes. And if we even have a little bit of dry eye, suddenly it becomes a lot worse.
So is there, with the dry eye, is it just, do you just carry around a tube of drops, or is there something that you could do to the eye to fix it?
That's a great question, and there are a number of things you can do. Lubricant eye drops, or artificial tears as some people call them, are available without a prescription, and probably the most often overlooked thing there is to try different ones, because not every lubricant works for every eye. Just like skin moisturizers, you may not like one, but you love another, and it's the very same thing with our eyes. Another really simple thing we can do when we go outdoors, where a lot of people have their dry eye symptoms, is to wear glasses, and they don't need to be tinted, but glasses that wrap around or fit closely enough that it provides sort of a humidity chamber. So you don't have those air currents constantly impacting the eyes and causing, you know, the symptoms that we feel. So those are two simple things you could do, and certainly there are others as well.
I saw that, yeah. Some of these glasses, these are called wraparound glasses.
Yep, and you know, they don't need to be anything made special for you know, for dry eye. They're you know, you can get them at the drugstores. You can get them from any good optical shop. If you're going to get sunglasses, it's worthwhile to get something that also protects you know, the eyes from UV. So you want to know that it is 100% UV filtering. You know, so you combine that with the artificial tears, and we've got a picture of a number of different tears that are available. That, you know, we don't particularly advocate one brand over another because it really is so individual. However, if someone needs artificial tears or lubricant drops more than 4 times a day, we tend to recommend that they consider using preservative-free drops. Almost all of the types you see on this picture they come in a preservative-free variety or a minimum preservative variety. Preservatives are held inside the bottle to prevent bacteria and other contaminants from growing. And so it tends to be a little more expensive because they're a little smaller bottles if they're preservative-free. But if you tend to develop irritation or sensitivity to one particular drop, it may be because you're taking it so often that you're developing allergy to the preservative. And so that's why we recommend considering preservative-free drops.
And these are just all over the counter drops.
Most of them are. There are just a couple that are what they call behind the counter, and actually they don't require a prescription, but often we prescribe them so the patient will get a specific thing. One brand like that is called Fresh Coat. It's an excellent choice. Okay. You can get it at the pharmacy without a prescription, but usually it's not out on the shelf with all the others that.
What about the bloodshot eye? And I'm looking at you, and your eyes are blue and white and clear, and they look pretty good.
I hope so. No binge drinking last night for me.
I always.
I've got 3 kids. I'm up early and to bed early. My life is not very exciting.
I'm always fighting the bloodshot eye. Yes. I don't know.
I won't make any lifestyle judgment there. No. It's very common among everybody, and particularly when we first wake up in the morning, because we have. You know, our eyes aren't producing tears. For our eyes to feel comfortable and look good, we have to have a nice normal layer of lubrication. And that comes from a whole lot of chemistry. In our tears, actually, there are 3 layers that give us good vision and good protection of the eye. There's an oily layer at the surface, a water layer in the middle, and mucus that rests against the eyeball itself, against the cornea. And that oily layer is actually it's the smallest part in volume of our tears, but it is often the most common. 70% of people with dry eye have a deficiency of the oil, and it is not replaced by the artificial tears that we mentioned. There are a number of treatments for oil deficiency, which goes by many names, including blepharitis and meibomian gland dysfunction and evaporative dry eye. Those names get thrown around, and you need to know what those are. It includes warm compresses, placing a moist heat on the eyes. That often helps to cause more secretion of oils. We have a new treatment called LipiFlow, where these glands, called the meibomian glands, are actually physically warmed and mildly compressed. It's not an uncomfortable procedure. It's quite comfortable, but that procedure we've found great success for people with a specific type of dry eye. And I guess the take-home message here on dry eye is that if you've got it, you need to be in touch with your eye doctor so that you diagnose properly what type you have and what the best treatment is. And so we advocate sort of an educated approach. One of the difficulties that comes about because of this oil deficiency is that the oils in the eyelid actually get sort of consumed by bacteria that exists on our skin and gets into our eyes, and it converts it from an oil, which is what we want, into a soap, which we don't. If you think about how soap was made by the pioneers in the old days of the frontier, they used to take fat, animal fat, and mix it with lye, and it would heat it, and that would convert it into soap. And they would get cakes of soap that is very similar to to ivory soap. And we actually have the same chemical reaction, it's called saponification, occurs on the surface of the eye, and it makes the soap you just saw in that picture. This foam is on our eyes. And so you think about what it feels like to get soap in your eye. That same burning sensation people with oil deficiency very often develop. We see this. This is a picture of an eye. And it's just incredibly uncomfortable. I can tell you that many, many people walking around here in Laguna Woods Village have this type of condition going on.
And if someone does have that, and it's painful and all that, what kind of thing? Is it an immediate surgery they need, or is there just something you could do?
Well, the good news is that the most sort of the frontline treatment for it is something you can do at home. It's hard to diagnose it yourself, but one of the simplest things people with uncomfortable eyes can do is take a washcloth with warm water, not hot, just warm like you'd bathe a baby in, and let it rest on the closed eyes for 5 minutes or 10 minutes. Keeping it warm, you have to stop and rewarm it. If you want to get fancy, you can take a small potato or take a hard-boiled egg and wrap it in the washcloth so it stays warm inside there. But again, not hot. And put a little gentle pressure on the closed eyelids, just near the eyelashes. What that does, after you've warmed the eyelid, is it stimulates the oil production. And it causes those oils that are in those glands we showed you the picture of to be secreted onto the eye, and it causes the eye to become very comfortable.
Wow, that's
simple. No surgery required.
that is really interesting. I've never heard anything like that, and I don't feel very comfortable just putting Visine and all that stuff in my eye. Because I know it's 5 minutes, and then they feel worse than they did before.
Well, that's true of any redness reliever. If you're going to be going to a wedding or have your picture taken or going to be on camera, it's okay to do that once in a while. But if you use redness reliever drops every day, you develop what they call tachyphylaxis, a condition where you end up having more redness come back and more issues with withdrawal from that drop. So you really need to be careful about not overdoing it with those types of medications.
Okay. Well, doctor, I saw you're a professor at UCLA.
I am.
Do you drive all the way down there, or do you live out there?
No, I live nearby here in Laguna Beach. I go to UCLA a number of times every year. Most of my teaching is, in episodes that happen, all told, probably 5 or 6 times a year. So it's okay. My kids have grandparents. My wife's parents live near Santa Monica, and so it's a nice opportunity to get our kids up there when I go teach.
Okay.
So, yeah.
So you live in Laguna Beach, and your office
I teach and do research at UCLA, that's right.
And your office, if someone does want to go see you.
Yeah, we have an office right here next to the village by Gate 2, Harvard Eye Associates. Our building is a black building right across the street from the front doors of Saddleback Hospital, and we have a group of 11 ophthalmologists there who range in specialty across the board from cornea, which is what I sort of do, to retina at the back of the eye, and then everything in between, including eyelids and every other thing.
Okay. So if someone is interested, they can call that phone number, 951-2020, and the 2020, I guess, is a reference.
Appropriate, yes. That's right. That's what we aim for.
Well, thank you, Dr. John Hovanesian, and you can call that phone number if you want to set up an appointment. And I hope to have you back. I feel like I learned a lot.
Thanks, Johnny. It's a pleasure.
Well, coming up, we've got, let's see, Roger Turner's going to be here. He's going to be giving us a United update, so that's something you might want to stay tuned for. That's coming up right after the break. We'll be right back.